Hi, everyone, and welcome to the IIGH Student Symposium. My name is Will Jardell, and I am a program specialist in research and education at the USC Institute on Inequalities and Global Health. One of my favorite things about my job is working with and collaborating with the incredible students at USC. We have a great group of student presenters who will all be sharing about their involvement with USC IIGH activities and opportunities, including the IIGH Student Advisory Council, Global Health Case Competition, research projects, and the SDG Leadership Academy. Each student will present, and then once all of our 5 students are done, we will have time for Q&A about their experiences, as well as answer any questions you may have about applying for these opportunities. Before we begin with our students, I want to introduce Dr. Shubha Kumar, who is the Director of Education at IIGH. Dr. Kumar, the floor is yours.
Thanks very much, Will, and thank you to all the speakers today, as well as the folks who are attending. We really appreciate your time to share a little bit more about the Institute and our education opportunities and what students experience directly themselves. So to give you a little bit of background about the Institute on Inequalities and Global Health, we are a university-wide center of excellence in global health research, education, and policy engagement. We take a dynamic and multidisciplinary approach to addressing health disparities and inequalities that impact our world. And just to really emphasize, the multidisciplinary approach is really key to what we do here. And I think you'll get a taste of that when you hear from the students in terms of how that plays out in action. So our mission really focuses on addressing health-related disparities and inequalities by expanding the evidence base. So that's really about doing research and multidisciplinary research, and then training the next generation of global health leaders, all of our wonderful students here, and informing public policy to more effectively contribute to global health outcomes. So I'll just give you a brief overview of the education opportunities that we offer through the Institute. First of all, for anyone interested in global health at USC, there are undergraduate and graduate degrees in this area. As far as undergraduate majors, there's a global health, there's a health promotion, and then we have graduate degrees in Masters of Public Health, Masters of Global Medicine, and others. So there's definitely degree-related opportunities in global health. We also offer some specific courses abroad that are taught by IIGH faculty. So we have graduate courses, one that goes to Geneva, that's about global health governance, one that goes to Costa Rica, that's about sustainable development and health. We also offer some really interesting global health courses with our Association of Pacific Rim Universities partners. What I mean by that, those are some online courses that we partner with 5 to 6 other universities around the world who online, and we teach about global health ethics. We also have a course in global health leadership, and that's a really fun experience for students to get to work with other students directly from different regions. We have some online short courses, such as drones and global health and NCDs and human rights. We offer a global health case competition every year, and I'm going to let the students speak to that a little bit more, but you'll hear about it. And our next one is coming up this February. We have fellowships that we support students to be able to travel abroad and do research. We also offer internships through the Institute, such as SDG Leadership Academy, and you're going to hear more directly about that from the students. We also support students to complete international practicum. Several of our MPH students are interested in doing practica in different places around the world, and we will help facilitate those placements, as well as students who are interested in research opportunities, whether you want to do those research opportunities for course credit or voluntarily, or we sometimes have paid opportunities. So we have plenty of research opportunities for students to engage in, which you'll also hear about today. And then we offer a speaker series where we have amazing speakers from industry and from all over the world who come and speak, both online, and some of the events are in person, where we can really offer an opportunity for students to learn directly from those who are practicing in the world of global health.
Perfect, thank you. First, we have Jessica Santos, who is currently serving as one of this year's co-chairs for the IIGH Student Advisory Council, or SAC. The SAC is a group of multidisciplinary students from across the university who advise and provide valuable insight to support the Institute's mission and vision. The SAC began in 2019 and has been involved in developing the strategic plan for IIGH and develops events of their own.
Hello, everyone. My name is Jessica Santos. My pronouns are she, her, and as Will mentioned, I'm serving this year on the IIGH Student Advisory Council as a co-chair. And just some information on some of my involvements with the Institute. Earlier in the year, I was granted the opportunity to serve as the student representative to the Health and Human Rights in the Climate Crisis Conference. And this was a very unique opportunity that was able to help shape my direction in forming a good career trajectory by integrating my degree in chemical engineering, which I will be completing this upcoming spring, as well as my master in public health, the global health concentration. Next slide, please. So before I get into some of my deeper experiences with IIGH, I wanted to go over some of my values that really inform why I do this work and why I aim to continue learning and engaging with such a wonderful group of interdisciplinary colleagues. So I really do believe in this quote by Margaret Mead that never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And this really speaks to my interests in combining human, animal, and environmental health to ensure that everyone and everything on the planet is able to live freely and be able to sustain itself for future generations. And some of my other values that inform my interests are polymathy, collaboration, love of lifelong learning, as well as empowerment, flexibility, self-reflection, freedom, and human dignity. Next slide, please. So my involvement with the IIGH began almost 3 years ago, and I was initially invited to an IIGH seminar by one of my mentors in the Viterbi School of Engineering, and he introduced me to Dr. Sophia Gruskin. And after attending this first seminar, I was immediately interested in all of the exciting topics and speakers that the Institute brought, and I became a regular IIGH attendee. So that following year, I was nominated to serve on the Student Advisory Council, and I served my first term from fall 2020 to the spring of 2021. And during this time, I was able to attend 5 different IIGH events, as well as contribute meaningfully to some of the upcoming speakers and events that were invited. So now, catching up to fall 2021, I was nominated for the position of co-chair for the Student Advisory Council, and I currently serve in this position with my colleague, Gaia Morales. And I will hold this term until the spring. So some of my goals as the IIGH co-chair are to develop a strong community and peer support among the SAC members. As Will mentioned, this wonderful group of students comes from a variety of disciplines from across the university, including history, global health, ethics, political science, etc. So my goal as a co-chair is to really deeply engage a sense of community within this group so we can hold meaningful discussions and learn from each other. Because ultimately, every single member of the council brings a unique perspective and unique context that builds everyone else's understanding of global health. So to my next point, my other goal as IIGH co-chair is to develop new partnerships across the broader USC community. Earlier this semester, the SAC was successfully able to establish a partnership with the Environmental Student Assembly on campus, and we were able to promote our events through them and share some of the great opportunities that the IIGH offers with the broader USC community. And lastly, my goal as IIGH co-chair is to increase interdisciplinary opportunities for SAC members. As I mentioned, everyone brings unique context and unique value to the council, and I want to ensure that everyone is able to take full advantage of these. And I'd like to use my current platform and my network to help lift up my peers as well and ensure that they're able to engage meaningfully in all of these events. So to speak further on some of my involvements with IIGH, as I mentioned earlier, I was selected to be the student representative to the climate conference, and this unique opportunity allowed me to form some questions for the keynote speakers on the opening session. And it was just such a fascinating experience getting to speak to and ask questions to some very high profile leaders in global health, and a very fun opportunity that came about. The former Prime Minister of New Zealand was actually able to like my LinkedIn post, which was fun. But just getting able to listen to such a variety of speakers really gives me hope for the future, and knowing that there are international solutions and international partners that are willing to work together and develop good solutions to not only global health issues, but the climate conference. And this was a very unique opportunity to contextualize some of the international problems and solutions ahead of the COP26 conference. So some of my other global health adjacent involvements include my current research and internship position through the USC Environmental Health Centers. I'm currently in my second year, and my research focuses on environmental justice and popular learning activities. And the community that I work with primarily are South Central Los Angelinos. And another involvement that I had earlier in the year is I was selected to be on the planning committee for the 2022 Los Angeles Global Health Conference. And lastly, I was selected earlier in the year to be the USC student representative for the APRU Global Climate Change Simulation. So in terms of my future goals, I strive to integrate IIGH programs and coursework into my remaining MPH courses. I really hope the Geneva course is able to come to fruition, because I would love to take advantage of that. But regardless, I do plan on integrating some of the great programs that IIGH has into my remaining coursework, and I would be honored to continue serving on the SAC until I graduate. And in terms of my career goals, I really, in the long term, want to influence environmental regulatory policy and empower communities to pick up environmental justice work, just because I believe there's so much power in local groups. And to pursue these efforts, I would like to get a law degree. I'm interested in the Harvard Environmental Law Clinic that they offer, and I would also like to expand my interest with the Master of Public Policy. Thank you everyone for your time. Here's my contact information if you have any questions. Thank you, Will.
Awesome. Thank you so much, Jessica. If anyone is interested in applying for the Student Advisory Council, the application is rolling. And so you can find the application on our website and join the Student Advisory Council. Next, we have Sachin Narayan, who competed in the 2021 Global Health Case Competition, where he and his team won the competition and went on to represent USC at the Emory International Global Health Case Competition. The case competition brings together students from across the university to respond to a case. Last year's case dealt with climate change and present a solution to a panel of judges. Sachin, the floor is yours.
Perfect. Thank you so much, William, for that introduction. Hi, everyone. My name is Sachin. I am a senior here at USC, and it's really nice to get to speak to everyone, albeit in the virtual environment. And yes, as the slide eloquently shows, I was part of the team that was able to win the previous year's Global Health Case Competition. So a little bit about myself. I am currently a senior, as I mentioned, planning to graduate in the next spring, May 2022. I'm originally from San Jose, California, so from the Bay Area, so I'm fully a California boy, living always out here on the coast in the nice weather. I am a global health major, so I can speak to any individuals who are interested about what the actual academic program looks like, as well as with minors in business, finance, and natural sciences, along with my major-minor combination and anything else I have here. I'm also a pre-medical student, so I'm hoping to join a medical school sometime in the near future. A little bit else about me is also shown on the slide. A couple of other of my engagements, I think a couple of relevant ones, if you'd want to say so, are up here on the slide as well. Apart from my family coming to Family Week in the bottom left, my other engagements in extracurricular activities around campus really focus on health and social inequities, et cetera. As part of LACY, which is Los Angeles Community Impact, I have significantly led a lot of the pro bono and nonprofit consulting services. I work as a free clinic staff at Rhoda Care Bear area during the pandemic, helping with individuals who do not have insurance. As part of Project Rishi and Trojan Knights, I'm pretty involved in their services. And as well as starting the Doctors Without Borders student chapter at USC, I'm also a cancer researcher in the US Michelson Center Convergent Science Institute in Cancer. So if any of those interest you, definitely come talk to me. Next slide, please. So one of my other main engagements, I would say, in the whole public health sphere is I am the founder and current sort of CEO, leader, whatever you want to call it, of Cathartic, which is a social enterprise nonprofit that is born out of the USC community. As a brief sort of snapshot of what we are, we're what we call the supply matchmaker for equitable health and hygiene, attempting to connect corporations that produce preventative health and hygiene products with community organizations that work with underserved populations and at-risk groups. Ultimately, we try to sort of act as like the eHarmony dating site for corporate donations to redistribute these programs and these products. So for anything from tampons to condoms, to toothpaste, sunscreen, everything that you could relatively think of in preventative health, we try to tackle a variety of different of these resource inequities for under-resourced populations in Los Angeles. So again, if you're interested about this, come talk to me. But really why I'm here today is to talk a little bit about the Global Health Case Competition, which is what I participated in this last academic year. I really want to quickly shout out the rest of my team, who is unfortunately not able to make it today, but me kind of representing the five of us, Joseph, Isha, Reese, Marcus, and myself, eloquently named Germs is what we called ourselves, which we thought it was kind of funny. But it's a little bit of a kind of like a high level takeaway about what we thought. William and Dr. Kumar previously described what the case competition looks like, but it's ultimately a 2-week sprint where you're really given a case, you're given a massive packet of information, and 2 weeks to really break your head about how do you envision creating a program that is really implementable, ground up, and a community-driven solution to solve a specific health challenge. And that kind of idea to really iteratively work from the research process all the way through to a point where you can come up with a solution is something that the five of us really embraced. So going on to the next slide as a really quick sort of intro to what we did. What we came up with in our USC Global Health Case Competition was something we call Project Guidance, which is short for ground up interventions designed to answer need for community engagement. And ultimately what this program was a ground up community solution to help tackle some of the tsunami preparedness in the Philippines, especially considering the fact that they've been rocked by a lot of these typhoons and a lot of the health challenges that have resulted from it. And ultimately, when you look at this photo, William, if you can hit the next slide button, you can see a lot of these different massive inequities that just jump off the page. And these were some of the different challenges that we were hoping to address from a community ground up way. Everything from debris blocking evacuations and the actual response, damaged energy grids, widespread psychological traumas, the contaminated flowing water, insufficient immediate aid, and devastated economic livelihoods were some of the many different problems that we looked at when thinking about what does a super typhoon really cause for these communities that are not as well funded and well resourced. So going on to the next slide, what we were able to structure is a variety of different programs that were designed to focus on the Eastern Visayas region in the Philippines, where we could reallocate some of our resources, our community partners and networks to really drive a ground up solution, as the name said, which is effectively a way that we can engage community members to really take action in their preparedness, in their response recovery, and then mitigation of the ultimate effects. So with that, there were a lot of different strategies that we presented, a lot of different experts that we reached out to, and it was really a very empowering experience for us to be able to look at a problem and in 2 weeks say, hey, can we come up with something that is not only financially feasible, but also makes sense to really implement? And we are really fortunate to be able to present this to panel judges who asked us some very insightful questions, breaking down, poking holes in everything that we did, and ultimately being selected as the winners of the USC Global Health Case Competition to then represent our school at the Emory National Competition, International Competition, which is actually this next slide. So I wanted to throw this up there. We do have a YouTube video, so if you want to whip out your phone, scan that QR code, you can go check out me and my team talking over a very interesting virtual performance, if you want to call it. Unfortunately, obviously with the pandemic over the past year, the Emory Morningside Case Competition was not held in Atlanta, in Emory, but it was rather virtual. So we got to do schoolwork while doing this competition, which was unfortunate. But we were able to tackle a couple of the challenges that were very pertinent to the time. The main case competition prompt being that to try to tackle vaccine hesitancy for the COVID-19 vaccine in a number of select countries. And we picked Nigeria out of the ones that they offered us. After, again, around a week and a half of craziness of work and a long of sleepless hours, we constructed the program we called LaFIAVac, which is really designed, again, to activate certain community thresholds and interesting points that can kind of act as like a wheel and a spoke, called the hub and spoke model, to mobilize the rest of their communities. And if we go to the next slide, you can see again, a similar layout to, okay, what is the real implementation focuses about how we roll out one of these programs. So the Emory Morningside case competition was incredible. Obviously virtual is a little bit different, but I'd highly recommend for anyone who's interested to really go as hard as you can in the USC competition, because it's a great experience. You meet a lot of cool people, and even in the virtual environment, we met some great mentors and people who could really open our understandings to what does global health solutions look like? How can we as students, we as the up and coming members of a global health society, try to focus on changing what we do and adjusting to the ideas of the times. And I think having had the opportunity to do this, I'm very grateful that I kind of can look at the COVID-19 pandemic and our vaccine response a little bit differently. So looking ahead, I think the global health case competition, as well as the work that IIGH, as well as my major, has shifted a little bit about what I really want to do going forward. And I think the first of which is really opening my mind to what do global medicine and community interventions look like. And that has kind of guided me towards really trying to look beyond our borders to global health gap year aspirations, working with some professors that I've met in the department. And my second idea is the whole driving concept of systematic approaches to tackling health inequity. Being someone who is hoping to be pre-med, I do also want to step outside the clinic and thinking about what are the systems, at least domestically, that kind of create barriers or open up access to healthcare. And with that, I'm hoping to get an MD MBA to really focus on the health infrastructure as well, and think about how can we democratize healthcare to make it better for everyone. So thank you everyone for listening to me, and I'll love to field your questions at the end, and I can throw my contact information in as well.
Awesome. Thank you, Sachin. So the case competition is coming up, and applications for your team are due at the end of January, January 30th, and then the competition will take place on February 18th. Next, we have Lily, who has been a student researcher with the Institute on many projects, and she will share with us about her experience working on research. I've worked closely with Lily, and she is a great researcher and has been an asset to our research team. Lily, the floor is yours.
Thank you so much, Will. You get a little shout out in this as well. It was awesome working with you. So my name is Lily Guo, she, her pronouns. And then here are just a couple of things that are really relevant to who I am, both as a global health and public health scholar, as well as just a person. So I'm in this organization called Troy Camp. I'm sure a lot of you have heard of it. It's a student-run organization providing long-term mentorship. And then me, along with my other co-chairs, started the position of advocacy and inclusion, where we run a book club and a committee to talk about those advocacy and inclusion related topics that are really relevant to our organization. I'm a global health major. I actually took a gap year where I was able to work with the IIGH. And so currently I'm going to graduate in spring of 23. I also have Spanish and education and society minors. And then I'm just seeing my other co-chairs in the chat, which is awesome. And then also a research assistant at the Children's Data Network, which is this really cool research hub that uses linked administrative data. So big data sets like birth records, death records, CPS records, and does a lot of public health and child welfare research based on that. And then what y'all came for here today, I'm a student researcher with the Institute on Inequalities and Global Health. Next slide, please. So the first project that I worked on was this global policy survey administered by the WHO, or the World Health Organization. Basically, we examined legal documents from member states that replied to this survey. This is a mouthful on sexual, reproductive, maternal, neonatal, child, and adolescent health. I call it SMRNCA. But basically, we took a look at those documents, saw if the evidence from the documents lined up with the survey responses, analyzed all of the data from the legal documents, and then we created a report to be submitted to the WHO that really analyzed all of that data and put it together, and then included survey improvements as well. Next slide. So what that meant, next slide, please. Thank you. What that meant was some really big spreadsheets. I have blocked out the country names because I don't think the data is public yet. However, we looked at, the number of answers that matched, didn't match, looked at all of the different countries by country, region, question, and then if you'll see at the bottom, we have a tab for every single 99 country that that participated in the survey. And then this is just a little segment from our report where we noted some issues with some common issues with survey questions and then provided recommendations. And I worked on this project primarily with Dr. Ferguson, as well as Dr. Gruskin, who's in the Zoom right now. It was a really awesome experience. Next slide, please. So all of this was also funded by the Undergraduate Research Associates Program, or URAP, which is a really awesome opportunity. And this was part of my product that I gave to them at the end of the semester. It's a lot of text, but basically there's this global push to prioritize the health of women, children, and adolescents, resulting in the Global Policy Survey administered by the WHO. Member states are asked to upload source documents to back up their survey answers, basically. And then our team was responsible for laws and official UN languages. We verified all sorts of information about the documents, for example, if it was a law or not, which we got training from Dr. Gruskin. And then we went to phase 2 validation, which basically asked, do these laws provide sufficient evidence for the questions that we're asking, culminating in this big analysis and report. Amazing. So the second project that I worked on with the IIGH was this UNFPA report, which is where I worked most closely with Will and Dr. Ferguson. We conducted this enormous systematic literature review, read some 600 articles or something like that on sexual and reproductive health globally. And that was awesome. Really saturating ourselves in the literature was a lot of information coming into your brain, which is very useful going forward. But my favorite part by far was the country case studies. We chose 4 countries and looked at the legal environment for sexual and reproductive health. And I was most focused on the Malawi case study along with Will. So this was really awesome because we got to have interviews with key stakeholders like judges, public health officials, doctors, abortion advocates, stuff like that. And they were very awesome. I had to restrain myself from being like, can I just talk to you for a little bit longer? And then at the end of all of that, there were just a bunch of pages, a bunch of reports for the UNFPA. Next slide, please. So this is what the data extraction looked like. This only shows 4 articles, but you can see there's 4 tabs. And then this is the abortion section, which was one of the biggest sections. And we got to really parcel through the literature and look at the different structural, societal, and legal factors that can impede a perfect implementation of a law, basically. Next slide, please. This is a couple of our tables of contents. This one on the left here is for the literature review. So we took all the different services, again, looked at those legal, structural, and societal factors that impede implementation and access of laws. And then over here was the draft of the Malawi case study that Will actually drafted. We looked at the legal environment of sexual and reproductive health in Malawi. We looked at the different stakeholders based on our interviews, and then also looked at the different factors that can impede or bolster implementation of certain laws. Next slide, please. So all of that being said, what is next? There's a lot that I do not know, such as more school, more work, probably both, as I'm sure all of y'all are familiar with. I think most likely graduate school PhD is going to be necessary for the kind of research and academic stuff that I want to do. And I also am not exactly quite sure where I would be best placed in the world and realm of public and global health to achieve maximum impact. One of my issues, and I'm sure many of the very interdisciplinary students and professionals in this Zoom know, is that I kind of want to do everything, which isn't really possible. Next slide. But what I do know, and I really appreciate Jessica for bringing up those values, because right now I have a set of values and that's the thing that's going to guide me, and I don't have much clarity elsewhere. So I know that I love education and mentorship. I love both learning and teaching. That's really evident through my minor and then the organization that I'm in. And previously, I wasn't really seeing myself going into working with these huge institutions like the UN and the WHO and stuff like that. But it's definitely, working with them has definitely given me a newfound appreciation for these countries' legal environments and how they have an effect on health. I think previously I was very much, I want to be very community oriented, legal environments weren't really on my track, but instead of seeing them as, two ends of a spectrum, now I'm able to see it as more of a big circle with a big environment and how everything affects everything else, and going back to wanting to do everything. So I also believe in the power of data and research. That's really clear through my work with IIGH and also with the CDN. I love big data sets and I think they're really cool. And I love, mixing and matching and cutting them in all different ways and seeing what findings we can find. But most importantly, and this has stayed true throughout my entire, global and public health career, I want my work to really align with my communities. I still believe that community-oriented stuff and prioritizing the community is going to be my biggest priority. And it's really cool to see that evident in all of the students' presentations already. So yeah, thank you so much. And next slide, I have some of my contact info if you want to talk about anything we discussed today or any opportunities or anything like that.
Awesome. Thank you, Lily. And also thank you for all your help on all of our research projects that you've been a part of. You're a massive asset. Next, we have Julie Leba, who was a fellow for the SDG Leadership Academy during summer 2021. The SDG Leadership Academy gives students a remarkable opportunity to help integrate global norms into the work of the Office of the Mayor of Los Angeles in planning and implementing critical policy issues. I'll pass it over to Julie to share about her experience.
Hi, everyone. And first off, thank you to USC IIGH, Dr. Greskin, and of course, William. We got to work under William's leadership as well. And he was such a great asset to the group in guiding us throughout our research project. So my name is Julie Leba, and I'll be discussing kind of my experience participating in the Sustainable Development Goal Leadership Academy. So here's just a brief agenda. I'm just going over broadly what the SDG Leadership Academy is, including its broad overview, and then what I learned as well. And so just a brief introduction of who I am. I'm a second-year Master of Public Policy student here at USC's Sol Price School of Public Policy. One of my primary policy interests is promoting health equity, particularly for low-income communities of color. It's actually one of the reasons why I decided to apply to the SDG Leadership Academy, because I thought it would be a wonderful opportunity to take a global perspective relating to health and translate it to effective policy goals at the local level. And I also, stemming kind of from personal experience, navigating the healthcare system for my mom, you see and witness firsthand kind of the injustices in health inequities, particularly in low-income communities. So I participated last summer for the SDG Leadership Academy, this past summer 2021. Some of the extracurriculars I'm involved in here on campus is the Graduate Policy and Student Administration community, and of course the Price Latinx Student Association. And so going into kind of the Sustainable Development Goals themselves, they were the foundation for our research. And so I think it's important to kind of just briefly touch upon them. As you see, there's 17 goals here that the UN developed. They're considered a global call to action to end poverty, protect the planet, and ensure prosperity by 2030. Each goal derives from a basic human right that the UN has recognized, including things like right to life, right to health, access to information, technology, you name it. Each goal has a specific foundation from a human right. And so the city of Los Angeles is one of the several cities in the US taking the initiative at adapting the SDG goals at the local level. And so each goal is interconnected, and that each is essential to promoting sustainable, equitable, environmental, and economic outcomes for all residents, including Los Angeles. So what is the SDG Leadership Academy? USC, along with several other universities, are partners with the city of LA, as Will already mentioned. The Academy specifically, it's a 10-week fellowship with USC's Institute on Inequalities and Global Health. And we actually were able to collaborate with Carnegie Mellon University students, which was a treat because we got to learn what other students are doing in regards to applying SDG goals at the local level. and not only to improve our research, but expand the scope and see how we can collaborate and kind of really brainstorm what are effective ways to get accurate data on whether these cities are meeting SDG outcomes. And so who we worked with, our research team was a cohort comprised, of course, of graduate and undergraduate students. Each brought a different level of expertise, experience, and backgrounds. And kind of what Lily and some of the rest of the speakers were saying is that it was really an asset to have such an interdisciplinary approach to the SDG Leadership Academy, because you got to learn. For example, we had someone who was from the public health, who was also from urban planning, and those things brought a really well-rounded understanding of the policy issues that were facing the city of LA. And so, of course, the team was led by Dr. Greskin and, of course, William. And as already mentioned, working with the Carnegie Mellon University students and faculty, it was a unique opportunity to work with them because you got to work outside kind of your comfort zone and area of knowledge, which made for a more well-rounded educational experience, in my opinion. And so this was, like I said, this was especially true since my cohort was made of amazing people of public health, global health students. And so what we got to learn was, it was a unique opportunity to learn how the COVID-19 pandemic impacted social justice indicators relating to the UN's SDG goals within the context of LA. You also get to access and develop what's currently working, what needed improvements, what could be done to ensure a just recovery in the city of LA, especially when it came to policy issues. And you also get to apply, at least with this experience, what you learn in the classroom by working with those closest in the community. As you'll see, we got to work with many community organizations to acquire additional data on SDG indicators for the city of LA. And so what I really mean by this is that we were able to dissect an issue or several and seeing whether LA was meeting the SDG goals they've outlined. And if not, what can be done to improve the lives of others. And this made it a really rewarding experience for me as witnessing firsthand some of the inequalities and inequities within the city of LA. And so we were able to kind of have, even if it was a small impact, an impact on the community in which we were all living in as students. So some of the central research questions, I won't go over all of these, but just in general, we were mainly trying to discover what was the data that exists around key research area and what additional information was considered necessary to ensure a just recovery. And so moving on, in order to answer some of these central questions, my cohort and we had the opportunity to conduct semi-structured interviews to map out who are some of the major groups working within the community and what new data we may find pertaining to our SDG goals. So of course, we got to interview groups, as you see here on the screen, SELA Collaborative, Advancement Project, and more. And it gave us a new perspective on how to look at policy issues in a multifaceted way. It was also great to network and explore kind of personally my career goals of being a public policy advocate. A lot of work that these organizations are doing is not just public policy advocacy, but actual policy analysis. Some of these groups had mentioned how the county of LA was trying to acquire more data on where some of the key health services are located and where are there gaps in the city of LA. So I thought that was really fruitful discussion, but also applied to my career and policy interests. And so the result of writing this draft, of doing this project, was writing a draft report on our findings and exploring what are the next steps for the city of LA to fulfill their SDG goals by 2030. And so as you see on the screen, some of the key takeaways, there's too many to count, but I don't have enough time to go through them because this was really an amazing experience that I had. I'm kind of sad that it was virtual. I wish I could have seen everyone in person, but one of the things was community engagement. One of the most valuable tools and insights I gained was working with those closest to the community. If you want to really create meaningful change, especially policy-wise, you have to involve those who have a stake in its impact. So one of the things I appreciated was getting to learn who is involved in issues such as health equity, internet access, especially And I gained kind of a new depth of understanding of the intersectionality that plays within promoting social justice. It was really eye-opening to kind of learn, and I wanted to talk about it, but I know we don't have enough time in terms of the lack of access to internet within the city of LA, and not only how that affected students, but also people just accessing basic healthcare because of, for example, telehealth services. And so it really just broadened my perspective on things and appreciated learning from others rather than, just, going through the motions of reading something. You really need to be involved with the community to learn more about an issue. And so the next thing also was the data and research, developing knowledge of conducting qualitative research and report writing. This is such a valuable asset that I took with me in my current practicum. Right now I'm working with LA County Department of Mental Health, and one of the major things we're going to have to produce at the end of this project is a report, almost exactly what we did for this summer cohort. I know I'm limited on time, but one of the other things that was central that I appreciate with the SDG program was allowing the students to lead and own the report and how we want it to present its findings. We were able to explore a new territory of writing that I think will serve each of us well in our career trajectories. And then finally, collaboration and communication. From working on this project, I learned the value of effective communication, which set me on the right path again for my practicum this year. It's something that people don't value, I think, probably enough, but I think that was so central to making a excellent team project. And so you're only good as your team, and if you're not working together, it will not be a good project. And I had an amazing crew of individuals, which I want to highlight here because they're not able to be here today, but these were the 3 amazing individuals I got to work with, and it was the reason why it was an excellent experience. So thank you, and I hope you enjoyed my presentation. I will drop my email too in case anyone wants to contact me.
Awesome. Thank you, Julie. Next, we have Hamsini Balaji, who has graciously agreed to join us as a former USC student to talk about her experiences with IIGH, including the case competition, which her team won in 2020, the IIGH Student Advisory Council, where she served as a co-chair, and as a researcher with Dr. Shruva Kumar. I will pass it over to Hamsini to share a bit more about her experiences as a Trojan and post-graduation.
Thank you, Will. Good to see you. Hi, Dr. K. It's always great to come back and talk to the USC community. So as Will said, I think to set some context, I'm not a current student. So I graduated in May of 2020. And when I was at USC, I was getting my master's in social entrepreneurship with a concentration in impact investing, which has been my focus. So my entire interest was always in mobilizing resources to direct products and services or increase access to those products and services in emerging markets. I would say my journey with I said I've put the slide up because I think I've had multiple touch points with IIGH and the people that have been involved in IIGH, and you'll see on the next slide who've been also a big highlight as part of my journey. But I started this interaction with IIGH by doing a research project with Dr. Kumar here. So it was more focused on impact measurement and impact management. And then we did a social return on investing project, essentially kind of evaluating the UCLA Mobile Eye Clinic that offers free of cost eye care for pediatric or for preschool students. So that's how I initially started, and that was more of my research efforts. But like Will said, it quickly grew into other components. So I served as the co-chair for the Student Advisory Council, which essentially is basically a group of students who act as a liaison for the needs of the students, plan events. I'm sure it's probably evolved to be much more. Since I've left, when I was there, what we essentially did was to set the constitution, set the mission, set the values of the organization, try to advocate for students' voices and needs. And of course, as Will said, I did participate in the USC Global Health Case Competition. Our team won it in 2020, and then we did go on to the international case competition as well. And similar to Julie, who presented to you about the SDG Leadership Academy, I did also take part in that, I think summer of 2020. So I was doing it the year before. And I worked with the Mayor's Fund for Los Angeles to help them identify how effectively they can allocate their resources to create change in the local community. So that's been kind of my journey with IIGH. Thank you, Will. And I think as I was reflecting on my time with USC, but also with IIGH, I kind of wanted to just bring up a couple of, I would say, philosophies or just a framework. I'm trying to talk to both audiences here. So if you're currently a student who's maybe early on in your student journey, or even those of you who are trying to transition out of school. But as I was trying to reflect through, what really guided me through my journey was obviously always lead with your values. I would say if you don't have clarity on that, that is the perfect time to get clarity on that. You're surrounded by just amazing people. The professors are great, faculty is great. You have access to a lot of resources that I think you may not receive after you leave school. Sometimes you just don't have the same kind of access to resources or just openness for people to chat with you, right? So always lead with your values, especially if you're a person of color or a minority group and you want to advocate for the lived experience of those communities. What worked well for me was always exploring, always experimenting. So as part of my program, I tried a lot of different things. There was a point where I created a social enterprise that provided low cost or subsidized sanitary napkins for women in India, where I come from. So just explore, experiment, see what works, what doesn't work. You'll learn a lot through that process. Obviously, try to be very empathetic in who you reach out to and the communities you work with. I worked in India because it's my lived experience and where I come from. So having that sense of groundedness will always help you in your work. Many people have said this. I jumped on a little bit later, but even the two folks who spoke before me said, be interdisciplinary. And I think that's very, very important in this work, especially post-graduation. You'll see that you will work with a lot of people from very different backgrounds. So you need to be open to understanding where they come from, and even just open to understanding and pivoting your ideas and your understanding of what you're working with. And lastly, or second to last, is always create your own opportunity. I came to social entrepreneurship from a very different background. So my undergrad was in biochemistry. People would have never thought that I would do social entrepreneurship. So people almost thought it was the right turn. But I always say, like, if you have a vision for something that you want, and if it doesn't already exist, then that just means you have to create it. Most of my work, even post-graduation, is that way, and I'll talk about it in a little bit, but always try to find a way to create your own opportunity. And last, but definitely not the least, is the importance and role of mentors in your life. And I have to give a big shout out here to Dr. Shuba, who I know most of you know, but she was very, very helpful and very instrumental in helping me develop my interests, my passion. She's amazing and has done a lot of really good work herself. And so it was very helpful for me to have someone like her to guide me through my journey at USC. So what am I doing after USC? So the picture you see on the right is essentially one of my active projects. So I co-manage a $23 million USAID funded program, which essentially targets increasing access to nutrition, women's empowerment, and wash services in Bangladesh. So the picture you see on the right is essentially we created a rural women entrepreneur group that will essentially buy products and sell them at a subsidized rate in low-income communities. But the concept was to kind of capitalize not just on women having their own decision-making and income opportunities, but essentially trying to see how we can optimize them as women influencers, because they had a lot of say in decision-making when it came to food purchases or wash product purchases or what was being brought just into the house. And so that is essentially a live picture of what happened through our program. I'm also currently designing a blended finance fund for healthcare social enterprises in East Africa and Southeast Asia, which is very exciting. I'm under an NDA, so I can't disclose a lot of details around it, but it is something that's very aligned with my skill set. And I think another piece of my journey with USC has also been that the skills that I learned there has directly translated into what I do now. So whether it was the impact measurement project, whether it was impact investing in terms of just learning about due diligence, financial modeling, interning with the Impact VC Fund, which you see on the slide here in Southeast Asia, but everything is directly translated into what I do now. So that's just a little bit about my work so far. I don't have my contact information on the slide up here, but I'm happy to drop it in the chat and very open to any questions. Please feel free to connect with me on LinkedIn and happy to answer any questions, or if you want to learn more about what I do, I'm very happy to have a chat.
Thank you so much to all of our student speakers today and to our alumni speaker. You guys are so gracious. And just to say, you guys all inspire us too, as much as you give your faculty and mentors credit. We really appreciate you all too. Your work continuously inspires us, both when you're students and all the amazing things you guys do afterwards. So thank you very much for all that you do. I'd love to open it to questions. I realize we're a little late on time, so we can maybe take one or two questions, and then I'm going to turn it over to Will to wrap up our event.
Perfect. And yes, please reach out to any of the students. I think they've all agreed to answer questions. And then also us, myself, Dr. Kumar and Dr. Gruskin, if you have questions for us as well, please don't hesitate to reach out. Just a little note about some of our upcoming opportunities that the students today have talked about. One is the virtual global health case competition. This is happening at the very beginning of the year. The deadline to register is January 30th, and the team is 5 students, all representing from at least 3 different schools within USC. So if you are a student who doesn't necessarily have a group of students that you want to compete with and you want to introduce yourself to other people, there is a virtual mixer on the 25th of January at 5 p.m., which will allow students who don't have a team yet to engage with each other and find a team that they can compete with. Last year, our virtual mixer, I think, ended up resulting in at least 3 teams who competed together in the case competition, which was awesome. The date of the competition is the 18th, but it starts 2 weeks prior to that when you get the information. So the actual presentations happened on the 18th of February. A couple of our other upcoming things is our courses abroad in Geneva and Costa Rica. Happy to say that they're happening as of right now. So applications will open in January of next year. Same thing with our fellowships. Those will be happening, and those are either abroad or including the SDG Leadership Academy, which hopefully is in person this year. All of those applications open up at the beginning of next year. And then finally, the LA Global Health Conference, which Jessica is one of the student representatives for USC trying to develop and plan for the conference. That's happening on January 29th of next year. If you want to get any information and updates on when these applications are made available, go to our website and subscribe to our newsletter if you haven't already, and you will be updated the second that applications open next year. And I just want to reiterate, thank you so much to the students for presenting and Hamsini for joining us. It was awesome to hear your experiences. I had the opportunity to work with all of you, which has been really rewarding for myself. And it's awesome to see you, Hamsini, doing so many incredible things after your time at USC. We were students together, and it's just, you're inspiring with all the work that you do. So thank you for joining us. And then also thank you everybody else for joining us in this symposium. And with that, if you have any questions, don't hesitate to reach out.